Gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy. This can occur at any stage of pregnancy, but is most common during the second or third trimester. While learning you have diabetes can be shocking for those who are otherwise healthy and have had no previous encounters with a disease, it is not uncommon for a pregnant woman to develop gestational diabetes during the course of her pregnancy. Sadly, many pregnant women are unaware that they are even at risk for developing gestational diabetes, let alone know how to appropriately recognize their symptoms and obtain the necessary treatment, as a result of the limited availability of high-quality medical information. High blood sugar levels originate from pregnancy hormones interfering with the body's capacity to utilize insulin, the hormone that converts blood sugar into energy, and this condition is known as gestational diabetes. While most women don't actually have any symptoms, you might encounter some of the following: extreme thirst, sugar content in urine, and frequent urination are some of the symptoms. What triggers pregnancy-related diabetes? Who is in danger? Having a high body mass index, BMI, prior to conception, maintaining a sedentary way of life. Receiving a gestational diabetes diagnosis during a prior pregnancy. Having a history of diabetes of any kind in the family. A polycystic ovarian syndrome diagnosis, PCOS. Having previously delivered a child that had macrosonia, weighing over 9 pounds or 41 kilograms. If you are of Middle Eastern, South Asian, Black, or African Caribbean descent. The oral glucose tolerance test, which takes about 2 hours to complete, is the most used method of screening for GDM. Typically, the test is performed between 24 and 28 weeks of pregnancy. The test could, however, be required of you as early as your first prenatal appointment if you possess specific risk factors. Gestational diabetes signs and symptoms. Unfortunately, the majority of pregnant women do not exhibit any noticeable symptoms during the early stages of the illness, making it difficult to recognize them. Some pregnant women may experience increased thirst or the need to urinate prior to receiving a gestational diabetes diagnosis, depending on the severity of the condition. Although gestational diabetes as immediate symptoms may not be very concerning, the long-term health issues and increased risk factors during birth tend to be the focus of attention. While a diagnosis of gestational diabetes does not equate to a difficult birthing experience, it is essential to understand the possible complications that both the parent and infant may experience as a result of the diagnosis. Preterm birth and high birth weight are two examples of difficulties that primarily affect the baby's health. The following are complications of gestational diabetes for the expectant mother: trouble controlling blood sugar levels following birth, increased chance of developing type 2 diabetes in later life, hypertension, enhanced potential for preeclampsia, a life-threatening condition, having an urgent need cesarean delivery. Risk reduction strategies including exercise in your everyday routine, the best method to control blood sugar levels and burn off any extra calories from a particularly large meal through regular exercise. Anyone who is pregnant should consider low-impact activities like strolling, yoga, and aqua aerobics. Consuming a balanced diet free of refined sugars. Diet has a huge impact on gestational diabetes management, just like it does for people with other types of diabetes. To minimize sharp peaks in their blood sugar levels throughout the day, it is advised that patients with gestational diabetes consume regular smaller meals and steer clear of foods high in processed sugars and dense carbohydrates. Keeping an eye on your blood sugar levels. A wonderful technique to determine whether you need to add more treatment options to your current gestational diabetes treatment plan is to monitor your blood sugar levels daily. To develop a more individualized treatment plan as your pregnancy progresses, these measurements can be recorded and communicated to your primary healthcare practitioner. Using safe blood sugar medicines during pregnancy. Pregnancy-safe drugs can be used. Your main healthcare physician will prescribe the particular medications you might need based on your unique requirements. While knowing how to manage gestational diabetes is important, What about individuals who want to learn how to avoid developing the condition in the first place? Making efforts to lead a healthy lifestyle before becoming pregnant will help lower your risk of later acquiring the illness and is one of the best treatments for gestational diabetes. Include the following healthful practices in your pre-pregnancy routine. 1. Daily exercise. 2. Keeping a healthy body weight. 3. Finding out about the medical history of your family. 4. Discuss your concerns with your primary healthcare provider. Overall, gestational diabetes is a rather typical medical issue that can lead to more difficulties during delivery. Having said that, a diagnosis of this illness does not ensure that you will experience a difficult delivery, that your child will have health problems, or that you will go on to acquire other types of diabetes in the future. The greatest things you can do to keep you and your baby safe should you be diagnosed with gestational diabetes, or to be aware of the symptoms, follow your treatment plan, and get medical help if you feel unwell.